children 5 to 11 years get the COVID vaccine because it helps prevent them from getting really sick. I know a lot of people think that when kids get COVID, they don't really get sick, but a lot of them who get hospitalized and really sick. It also prevents them from getting the complications of the COVID itself. For example, I know there was the news about myocarditis and the COVID. It was actually not the COVID vaccine that caused the myocarditis, but kids that got sick from COVID actually ended up getting myocarditis along the way. The COVID vaccine itself has been tested and the risk of myocarditis is really low. It also helps kids prevent other people in their homes and friends from getting the COVID itself, in that if there are younger kids in the home or other people in the family that can't get the COVID vaccine for one reason or the other, they are getting the COVID vaccine helps prevent them from getting COVID and spreading it to other people as well. For the parents that are reluctant to get the COVID vaccine to their kids, I say it has been tested. A lot of kids have been involved in the trial already. It has been going on for over 6 months, and it has been fine. You know, it's something that has been tested, and so I say trust the science. There's nothing better than science.
Thank you.
Thank you.
Good evening. They asked me to give a couple thoughts about how COVID vaccine relates to the mission of ProMedica. In simplistic terms, we can say that the mission of the ProMedica healthcare system and eBay Children's Hospital is really quite simply put is our mission is your health. So you can't think of a way that we could improve the health of our community better than all of us, adults and particularly children, receiving the COVID vaccine. As we just learned, and I agree completely, the side effect profile of this vaccine is unbelievably fabulous. We know that less children get sick with COVID. We know that very few of them end up in our pediatric intensive care unit, but we also know that a very small number of them will die. Imagine looking backwards thinking, I could have prevented my child's death with a simple immunization. There were naysayers when we had measles, and there were naysayers when we had polio. But look at all those things now 50 years later, and how convinced they are that they save lives not only here, but across the world. So I can't imagine anything that we could do that would be better for our community and better for the children in the communities we serve. What the vaccine really means is that we are going to get through this horrible 18, almost now 20-month pandemic that we've been in, hopefully a little bit quicker, a little bit safer, and with less deaths in our community and less long-term problems, the long haulers that we're seeing in both adults and in children. And as a practicing lung doctor, the less really severe lung disease we see from children and adults going on ventilators. I couldn't be more supportive of this vaccine than anything else we do in our entire time on this planet as a physician. So I'm 100% for it. And to people who ask me what's the risk versus benefit, I think it's so unbelievably balanced or leaning towards the benefit compared to the really, really, really tiny risk. Nothing we do is perfect. Walking out on the sidewalk tonight to go back to get to my car, I could have a bad accident. So nothing we do in life is perfect, but this is one that's so close that you can't believe it. So without any further ado, got Ms. Janet Moore, who's going to talk to us about the world from an infectious disease point of view.
Thank you, Dr. Burnett. My name is Janet Moore, and I'm a pediatric nurse practitioner specializing in pediatric infectious disease and faculty at the University of Toledo. We cover both local children's hospitals and cover all of the children that have complications from COVID, specifically multi-inflammatory syndrome in children. Most importantly, I'm here to speak tonight as a mother of a 12-year-old, an 8-year-old, and a 5-year-old. There have been many concerns about the vaccine, but I have no concerns myself, and all 3 of my children have been vaccinated, including the 5 and 8-year-old as early as this week. I think that the concerns that anyone has long-term, none of us have a crystal ball to predict, but we all know that the risks right now for ourselves or for others in our community are far outweighed by anything that we can do. I ask all of you and challenge you to help anyone to get to a vaccine site. There are so many locations out in the community, and I'd like to leave in conclusion with a comment from my 8-year-old this week who said, "I'm going to tell my friends at school that I'm helping save the world."
Hi there, good evening everyone. My name is Dr. Thomas. I am a resident physician at McLaren St. Luke's and the program director of Sunrise Gymnastics Academy. I wanted to start by thanking you at home for watching this, thanking McLaren St. Luke's for allowing me to be here, and thanking the VProject for doing what they do. They have this lofty goal of trying to vaccinate 70% of Toledo's population so that we can be a model for other cities. And I think that it underscores the goal that we should all have, that this is not an individualized thing that we're doing. This is something we're doing for our community. With that being said, I did want to speak to some of the specifics about the vaccine. So with that, the trial that all this information has come from, as we know, October 29th, the EUA that was released by FDA allowed for children 5 to 11 years old to be vaccinated. And in that study, from an efficacious standpoint, showed that the vaccine was 90.7% effective. And from, as she had spoken to earlier, from a standpoint of safety, it showed that there were no severe reactions. So with that, for me, when I'm talking to my athletes or my patients about how we can do things to protect ourselves from COVID, vaccination is always the first conversation, because primary prevention is always the best defense against vaccination in general. And I think it's important when you're comparing unvaccinated and vaccinated individuals that some of the facts that we do know is unvaccinated individuals are more likely to be hospitalized by 29 times, and they're more likely to die from COVID by 11 times, and more likely to get COVID a second time. So it's really important that we approach being vaccinated from a standpoint of not only protecting ourselves, but protecting others around us, that who, of no fault of their own, can't get a vaccination or don't have the ability to form immunity towards vaccination. So we're protecting ourselves, we're protecting our loved ones, and we're protecting our community. Thank you.
Yes. I want to tell you as a pediatrician, but also as a parent, how important it was to me to be able to vaccinate my children against COVID-19. You know, children don't die of COVID-19 at the same rate that adults do. But children don't die of anything at the same rate that adults do. But in 2020, COVID-19 was in the top 10 causes of death in children in the United States. That's a sobering thought. Especially now, to have a child die of COVID-19 when it is a preventable, maybe not necessarily 100% preventable illness, because the vaccine is not a shield. The vaccine is teaching their bodies how to respond when they come in contact with that virus. And it will help significantly prevent hospitalizations and virtually eliminate deaths. This is one of the most important things that all of us physicians who you've heard speak today feel that you can do for your children. And the 91 physicians that have signed this declaration behind me, 91 pediatricians and pediatric care providers, are all endorsing this vaccination for your children ages 5 to 11. It's been studied, it's been tested. It is a very, very remarkably good vaccine, and it is very, very safe. We gave over 1,200 vaccinations at Stranahan Elementary School this week. We've given a couple hundred here, and we're going to be giving a couple hundred more over the next few days. This is an incredibly exciting time because we can help your children to be healthy. And isn't that really all of us want, is for our children to be as healthy as possible? Thank you very much.
Any questions for the various panelists?
I think the first thing all of us want is everyone to state and spell their names.
Is
guys said it when you guys went up there, so as long as you.
You want to take a picture?
Oh, I have one question for whoever wants to answer it, but I guess when could we expect, with these vaccines in effect, when can we expect the cases to hopefully start going down, stop rising? What can it do when parents are taking their children to get vaccinated at this point with our numbers that are increasing?
I don't think there is a hard, fast answer to that question. There's so many things that affect it. The community where you live, the number of people who are immunized in the community where you live, where people are wearing masks, where people are not wearing masks, the people that you, probably bad choice of words, but you hang with, all of those things, what other comorbidities you have, you live with other children, you go to daycare. There's so many multifactorial components to this illness. Are we going to see new variant strains? So there is no way of being able to say if everybody got vaccinated by the 9th of December that it would be gone by the 12th of January. There's just not, it's not possible to do. You know, we don't know what influences from other regions and other countries are, so there's just too many confounding or things that will affect that long term. I don't think that any of us believe that it's ever going to be completely gone, okay? I think it'll become a seasonal, and Janet is probably the best one to speak about it, as she has a special training and interest in infectious disease, but I think probably we're going to see it along the lines of influenza, where we'll get seasonal vaccines, but we'll wait and see. We all thought this time last year that we were going to have a 3 or 4 month run, and we're now 20 months into this, and we're not fixed.
Thank you.
I have one. This is for anybody. Could you guys all kind of get Brandon the podium real quick? Thank you.
They can go to the
Yeah. There you go. Thank you.
Thank you.
That's good.
I saw, in preparation for this, I saw a statistic this morning that said out of states that reported COVID cases in kids, only 0.03 have died. Obviously, any deaths is terrible. But is the incentive to get your child vaccinated that strongly with only 0.03 reported deaths in the country?
So if you look just at deaths, that's not the only thing you look at. We see COVID long haulers in this group. We see kids who have significant cardiac issues. We have kids, I'm a lung doctor for kids by training. I probably see 5 or 7 new kids in my office every single week as a member of 5 pediatric lung specialists at our institution. And we're seeing lots of kids with leftover residual COVID lung disease. So it's not just the deaths, but it's a whole spectrum of comorbidities that we're left with.
And kind of adding on to his point, I would say that, again, this is not something that we can think of in an individual in a silo. This is something that affects not only those children but their families. It involves their ability to spread it and the effect that it has on family. If just one child dies, as Dr. Barnett mentioned, that's a life-changing event. So this is something simple that we can do to help prevent disease in our children, and as he had mentioned, the post-COVID syndromes that we really don't have a treatment for at this time. So.
May I add something too?
Yeah, please.
There's 2 other things besides the things that my colleagues have already said. One is multi-system inflammatory syndrome in children. That's a horrendous disease, and yes, if it's caught early, it's treatable. But that has led to some COVID deaths as well, and I know, because I have had my own child that was really sick with something else, and it's a helpless feeling as a parent. So to have your child really sick with MIS-C, when it is something that we can prevent at this point, that really is another reason to vaccinate. And lastly, you know, this pandemic has been incredibly costly on our children. Not as much in the terms of deaths, as we said, but again, as I said, kids don't die at the same rate as adults from anything. I mean, that's part of being a child. But kids have been hurt significantly in decreased social interaction, decreased learning experiences, decreased time in school with their friends. They have had an uptick in depression, anxiety, obesity. Kids have suffered in so many ways that are much harder to count other than just deaths.
Echoing what Dr. DeLucia said, in the pediatric infectious disease world, we see those children with multi-inflammatory syndrome. We've seen close to 40 this year already, and that's only in children that we know about that are getting hospitalized. There's other children on the mild end of the spectrum that we may not be seeing, or maybe just in the outpatient world. These children are severely ill with prolonged fevers. They can have cardiac effects, they can have GI effects, they can have effects on their respiratory system. We've even seen neurological problems with these kids, and even in those that don't fit into that, there's children that are having long-standing depression, fatigue, and issues in the psychiatric realm. So I think the way that we need to think of it is this is the only tool that we have. Beyond social distancing, beyond masking, we had a mom last week say, is there anything I could have done, in tears, and this is one thing that we can do as parents. The children still may get COVID, but there'll be a much lower risk, and even if they do, there's a less risk of these scary, scary complications that we are seeing every day in the hospital.
Thank you.
One more question for me, for whoever wants to answer it. Thanksgiving right around the corner, and with the vaccines, what are the expectations there? What are the recommendations?
I think they've just been what they've always been. You know, if you're sick, stay home. Try to practice masking and social distancing, and just use the tools that we've been using, you know, all this time to help protect our families and our loved ones. And certainly, if you can be vaccinated, because you will further protect those your loved ones, because that will decrease your chance of spreading disease.
No, you don't have to.